Inflammation is the body's natural response to injury or infection. When tissues are damaged, a series of events unfold. Blood vessels dilate, fluid seeps into the area, white blood cells migrate to the site, and proteins, like fibrinogen, accumulate. This process helps contain and eliminate harmful agents and typically reaches its peak within 6 to 8 hours if the injury is mild. As healing progresses, blood flow returns to normal, immune cells either break down or re-enter circulation, and the affected tissue begins to repair itself. Understanding inflammation is key to recognizing how our bodies fight off threats and start the healing process. Several types of cells are involved in the inflammatory process. Monocytes and macrophages act as scavengers, cleaning up debris and dead cells. Polymorphs, or neutrophils, are the first responders that attack bacteria and other invaders. Lymphocytes help coordinate the immune response and are crucial for long-term immunity. These cells not only fight infection, but also contribute to tissue repair and scar formation. Their coordinated actions ensure that the body can efficiently deal with injury or infection, paving the way for healing and recovery. Edema refers to the accumulation of excess fluid in the tissues. This can happen for a variety of reasons, such as increased permeability of capillaries, higher blood pressure, kidney problems, or a drop in plasma proteins. Inflammatory factors can also trigger edema. When it comes to the eyelids, edema can be caused by infections like blepharitis or conjunctivitis, allergic reactions, trauma, systemic diseases like kidney or heart problems, or even insect bites. Recognizing the underlying cause is essential for effective treatment. Angioneurotic edema is a sudden swelling, often affecting just one eyelid. It can be alarming, but is usually treated effectively with systemic corticosteroids like hydrocortisone or prednisolone. This type of edema is distinct from other forms because it appears abruptly and is often related to allergic or immune system reactions. Prompt medical attention and appropriate medication can quickly resolve the swelling and prevent further complications. Blepharitis is a chronic inflammation of the eyelid margin, often caused by poor hygiene, infections, or even parasitic infestations. There are two main types: squamous and ulcerative. Other common eyelid infections include styes, chalazyon, and internal hordeolum, all typically caused by Staphylococcus bacteria. These conditions are characterized by painful swelling, redness, and sometimes pus formation. Treatment may involve antibiotics, warm compresses, and in some cases, minor surgical procedures to drain the affected area. Trachoma is a chronic infectious disease caused by Chlamydia trachomatis. It progresses through several stages, starting with follicular conjunctivitis and potentially leading to scarring, trichiasis, and even blindness if untreated. Diagnosis is based on clinical signs and histology. Treatment involves antibiotics, artificial tears, and sometimes surgery. Prevention focuses on good hygiene and avoiding overcrowded living conditions. Neonatal conjunctivitis, or ophthalmia neonatorum, affects newborns and is usually caused by gonococcal or staphylococcal infections. Early intervention with antibiotic drops and proper hygiene can prevent serious complications. Eyelid trauma can lead to ecchymosis or hematoma, commonly known as a black eye. Initial treatment involves cold compresses to reduce swelling, followed by warm compresses and gentle massage to help absorption. Eyelid malpositions, such as trichiasis, misdirected eyelashes, entropion, inward turning, and ectropion, outward turning, can cause discomfort and require surgical correction or procedures like epilation or electrolysis. Symblepharon, which is the adhesion between conjunctival surfaces, often results from burns or ulcers and may need surgical intervention. Lagophthalmos is the inability to fully close the eyelids, which can be congenital or acquired. Treatment focuses on protecting the cornea using ointments or procedures like tarsorrhaphy. Blepharospasm is an involuntary spasm of the eyelids, often due to irritation or nerve problems, and is managed by addressing the underlying cause. Ptosis, or drooping of the eyelid, can result from developmental issues or muscle weakness. Surgical correction is often needed to restore both function and appearance. Tarsorrhaphy is a surgical procedure where the eyelids are partially or completely sewn together to protect the eye, especially in cases of exposure keratitis, paralysis, or ectropion. The technique can be temporary or permanent, depending on the condition. Eyelid tumors are usually benign, such as pigmented nevi or papillomas, and are treated with complete excision. Malignant transformations are rare, but require prompt and thorough management. These surgical interventions aim to restore both the function and appearance of the eyelids, ensuring optimal eye health.